a single dose smaller than a grain of salt. That's all it takes for fentanyl to shut down your breathing. In the US, it's now the #1 killer in drug overdoses, claiming lives every single day. But how does this deadly opioid hijack the brain and trap millions in addiction? The reality of drug addiction in the US. Drug addiction has become one of the most urgent health crises in the United States, with opioids at the center of this epidemic. Addiction is not simply a lack of willpower, it is a chronic disease that changes the brain and behavior. Millions of Americans are struggling with substance use disorder, and opioids, particularly fentanyl, are driving record-breaking overdose deaths. Addiction begins when individuals use opioids to relieve pain or experience pleasure. But over time, the brain rewires itself to crave the drug. This rewiring makes it extremely difficult for users to stop, even when they face severe consequences. In the US, fentanyl is now the leading cause of drug-related deaths, surpassing heroin and prescription painkillers. The crisis cuts across all social and economic groups, affecting teens, adults, and seniors alike. Communities have been devastated by rising overdose rates, children growing up without parents, and hospitals overwhelmed by emergencies. The cost is not only measured in lives lost, but also in billions of dollars spent on healthcare, law enforcement, and lost productivity. Understanding how fentanyl works and why it is so addictive is the first step toward addressing this ongoing national tragedy. What makes fentanyl so potent? Fentanyl is a synthetic opioid, meaning it is man-made in laboratories rather than naturally extracted from the opium poppy. It was originally developed for medical purposes, such as treating severe cancer pain or helping surgical patients manage post-operation pain. However, its potency is what makes it especially dangerous outside of medical supervision. Fentanyl is about 50 to 100 times stronger than morphine and up to 50 times stronger than heroin. This means even the tiniest amount, less than a grain of salt, can cause a fatal overdose. Illicitly manufactured fentanyl has flooded the US drug market because it is cheaper and easier to produce than heroin. Dealers often mix it with heroin, cocaine, or counterfeit prescription pills, making it almost impossible for users to know how much fentanyl they are taking. This unpredictability has made fentanyl the leading driver of overdose deaths in America. Unlike regulated medical fentanyl, illicit batches vary widely in strength, increasing the risk of accidental overdose. Its rapid effect on the brain also makes it more addictive than many other opioids, trapping users in a cycle of dependency that can be extremely difficult to escape. 2. How fentanyl affects the brain. The human brain naturally produces chemicals called endorphins, which help manage pain and create feelings of reward and happiness. Fentanyl mimics these chemicals, but in an exaggerated way. When fentanyl binds to opioid receptors in the brain, it blocks pain signals and floods the system with dopamine, the pleasure neurotransmitter. This sudden dopamine surge produces intense euphoria, but it also hijacks the brain's reward system. Normally, dopamine reinforces healthy activities like eating, exercising, or bonding with loved ones. But fentanyl creates an artificial shortcut, rewarding the brain far more strongly than natural behaviors ever could. Over time, the brain adapts by reducing its natural dopamine production and decreasing receptor sensitivity. This means the person needs more and more fentanyl to feel the same effect, a phenomenon known as tolerance. Eventually, users take the drug not to feel high, but to avoid painful withdrawal symptoms such as anxiety, sweating, muscle pain, and insomnia. Because fentanyl is so powerful, these changes happen much faster compared to other opioids, leading to a rapid and severe form of addiction that is incredibly difficult to reverse without medical help. The deadly risks of fentanyl use. The most dangerous effect of fentanyl is its ability to depress the central nervous system. At higher doses, it slows breathing, lowers heart rate, and reduces blood pressure. This condition, known as respiratory depression, is the leading cause of opioid overdose deaths. Unlike other opioids that may take longer to cause overdose, fentanyl acts very quickly, sometimes shutting down breathing within minutes. This leaves little time for medical intervention. First responders often rely on naloxone, a medication that can reverse opioid overdoses, but fentanyl overdoses often require multiple doses due to the drug's potency. Side effects of fentanyl misuse also include extreme drowsiness, confusion, nausea, and unconsciousness. Long-term use can damage the liver, weaken the immune system, and increase the risk of infectious diseases if injected with unclean needles. Beyond the physical risks, fentanyl destroys relationships, careers, and financial stability. Families are left devastated, and communities face rising homelessness and crime as addiction spreads. Because fentanyl is often disguised in counterfeit pills or mixed with other substances, many users unknowingly consume it, turning every dose into a life or death gamble. This unpredictability makes fentanyl especially lethal in today's opioid crisis. The way forward: treatment and hope. Despite the devastating toll of fentanyl, recovery is possible with proper treatment and support. The most effective treatment for opioid addiction combines medication-assisted treatment, MAT, with counseling and behavioral therapies. Medications like methadone, buprenorphine, and naltrexone help stabilize brain chemistry, reduce cravings, and block fentanyl's euphoric effects. These treatments give people the chance to rebuild their lives without the constant grip of addiction. Counseling provides emotional support, helping individuals address trauma, mental health struggles, and triggers that fuel substance use. Harm reduction strategies, such as distributing naloxone and establishing safe consumption sites, save lives by reducing the immediate risk of overdose. On a broader scale, the U.S. needs continued investment in prevention programs, education, and community outreach to stop addiction before it starts. Families, schools, and communities play a vital role in creating supportive environments that reduce stigma and encourage people to seek help. While fentanyl addiction is a powerful and destructive force, it is not unbeatable. With compassion, science-based treatment, and strong public policy, America can turn the tide of the opioid epidemic and give people the chance to reclaim their health, dignity, and future.